For the first time in 15 years, the American Academy of Pediatrics released new guidelines for treating childhood obesity, and they emphasize a need for early and intensive treatment. We're joined now by Dr. Rana Aldura. She's a pediatrician at MercyOne to break down these new guidelines. Dr. Aldura, thanks for your time this afternoon.
Thank you for having me, and thank you for giving me the chance to talk about this very vital topic. Let me just start by saying, obesity is one of the most, if not the most common chronic disease. It affects more than 14 million children in the United States. And the new guidelines really emphasize on more of aggressive, more intensive approach versus, the watchful wait with the old guidelines, just knowing how much it impacts not just physical health, but also mental health and the comorbidities that come with obesity.
So you're saying these guidelines, it's been a long time coming to give them an overhaul.
Yes, we are very excited. It does line out, it goes very deep in, knowing that obesity is multifactorial. It really breaks it down, to socioeconomic, genetic background, talking about going up in prices of food, lack of access to, healthy nutrition choices, and it's, yes, well waited for.
Very comprehensive. So let's talk about some of the questions that you get from parents, because weight, it doesn't matter what your age is, it can be a sensitive topic. And when we're talking about kids, I would assume it would be even more so.
Absolutely. And, the guidelines is really, it's not one fit for all. And of course, engaging and involving the whole family members make it, more worthwhile and more successful. Engaging the community, whether it's school, whether the media, avoiding promoting unhealthy diet. Yes, being a chronic multifactorial disease, we have to kind of approach it as such and take it a little bit more serious. And it certainly starts with, with the family, changing lifestyle, addressing the issue, reaching out for help.
So let's talk about a healthy, healthy weight. I know you say it's not a one size fits all, but when you have families come in and have concerns about their children, when you say what would be a healthy weight for my child, I assume that's a question you would get.
Yeah, absolutely. And of course that varies depending on age, sex, if there's underlying, like there's a mental, physical impact, all those really affect what to be expected to be as a healthy weight. But it all starts with, regular visits, whether you want to bring that with a wellness visit, to plot, your weight, your height, your body mass index, and, obviously you go from there.
So let's talk about treatment, because this is also included in that comprehensive plan, talking about treating kids earlier. Medication, even surgery they talked about, and we know that's not going to be the first item on the list or the first
Absolutely.
thing doctors are going to recommend.
Absolutely. And, there are certain age group and risk factors to meet those criteria. But, first is first. We've always talked about, healthy lifestyle, healthy choices of food, physical activities. The guidelines take it, even beyond that, to involve children with meal preparation, tasting their meals, to kind of be very vital part of the plan, because it is a long-term plan. It's, not something you just kind of deal with, spare the moment. You really have to have a follow-up visit and, again, total health lifestyle changing.
Yeah, that's what we talk about, that healthy lifestyle, starting it younger than ever, because what they do now will affect them for the rest of their lives.
Very true. Having an elevated BMI at an early age, childhood, carries on to teenage and carries on to adulthood. That comes with comorbidities, which really they are preset at children age, and then, may show later in life, whether it's, cardiovascular, hypertension, whether it's diabetes, and it goes on and on.
Okay. Dr. Aldura, thanks again for your time to talk about these new guidelines for child obesity and for your knowledge in this area.
Thank you. Thanks for having me.